We'll begin, though, with pharmaceuticals. It was only a couple of weeks ago we discussed GSK on the show, but there's been so much news flow in recent days it felt worthwhile to do so again. Let's begin, Julian, with the US drug pricing announcement this week. There's been plenty of uncertainty emanating from the US. The tariff uncertainty alone for pharmaceuticals has been more pronounced than in any other sector, which is saying something. And US proposals for companies to cut medicine prices have also added to the general confusion. What did we learn on this front this week?
Yes, it's been a very interesting week for the industry. What we learned this week was that the Trump administration struck the first voluntary agreement with Pfizer to cut discounts and make available cheaper drugs to patients in America, or at least to patients buying through the Medicaid program. And investors took a lot of heart from this. Firstly, it's not legislation. It's actually just a personal agreement, but people are taking the cue that this will form the basis for future agreements with other companies. So this so-called most favored nation trading agreement that the administration is pushing. And it will allow pharma companies who repatriate revenue, although nobody quite knows exactly what that means, but essentially as long as you are offering discounts to patients, you have home manufacturing in the States of some sort, you won't be forced to cut, or at least you won't be subjected to punitive tariff regimes or forced to cut your prices by too much. And this goes hand in hand with the launch of a kind of essentially like an online shopping portal for patients who want to buy drugs directly from pharmaceutical companies at discounted prices. But I think, as we all know, the way that there's discounts and there's discounts. So investors have taken this very positively, and the shares this week have responded to that. So in the first instance, AstraZeneca is up 5% in a week, and Pfizer itself is up by more than 12% since we wrote about the company a few weeks ago. So it's a very interesting and broadly positive picture, I think, on that front. But there are also company-specific things that have been going on, which have been very good for both Astra and GSK. But I guess we'll move on to that in a second. But definitely the lifting of some of that uncertainty over what this most favored trading nation status means in practice is behind a lot of the rally that we've seen.
Indeed, as you alluded to, in AstraZeneca's case, let's talk about them first. There was an announcement about one of their big blockbuster breast cancer drugs as well yesterday. I think shares closed up in the UK 9%, which is a pretty big jump, the combination of this Pfizer news and their own announcement. Can we say a bit more about what they've said about approval or potential approval for that drug?
Exactly. So Astra received what's called a supplemental biologics license application. So basically, it's an expedited regulatory review of its key cancer drug, Enhertu. And this was to move Enhertu to the first-line therapy in metastatic breast cancer. So this was given a priority review status. So it means that the FDA will expedite its overview of the drug. And often what that means in practice is that because it's already got a lot of safety data behind it, that that procedure will eventually go through as planned. And it will allow Astra to sell the drug to a much broader pool of patients. As soon as something becomes the first-line therapy, if anyone who's had any real contact with how health works, generally they have a sort of system of going in with one type of drug. If that doesn't work, then you sort of move up the value chain and use the more expensive ones. But Astra is showing enough benefit with Enhertu in the trials it's been using for this application that it could become the first-line therapy for this type of cancer. And that means that the total number of patients that it can sell to or will be allowed to sell to will increase quite significantly. So if you to put it into some sort of financial context, in the first half of the year, they're already selling like $2.3 billion of this particular drug alone. And the projections are that they will get to over 5 billion. And this application, this key application, is kind of a security that they will get past that number of total sales. And if you get past 5 billion in total sales, that is a proper blockbuster drug in pharmaceutical terms. That's why the market reacted so positively to that particular piece of news, and it does validate our strategy. I mean, we've said for years that oncology for AstraZeneca is definitely onto a winner. I mean, is definitely onto a winner with that, and it underlines that not everything is about weight loss drugs. I think that's the other point about it.
Well, indeed. We should talk about the other big piece of news for Astra this week, which has caused, well, depending on how you look at it, some concern. Some people are seeing it as a reassurance, which might be putting too positive a spin on it. But I am talking about the listing decision they've made to enhance their US listing, shall we say. Again, in the context of some concern that they would move the primary listing to the US entirely, which is off the table for now, but this could, who knows, in a few years' time be seen as a precursor to them doing just that, perhaps.
Yes, amusingly, the company describes it as harmonizing its listings, which is usually the cue for everybody else to argue about it. Essentially, they are going to upgrade the American depository receipts, which are currently traded in New York, and they're going to upgrade those to full shares. But they emphasize that they will keep their headquarters and tax base in the UK, as well as the London and Stockholm listings. It's often forgotten that Astra is listed on a kind of a parity basis in Stockholm. So, although admittedly Sweden is probably not the vast pool of investors that the US is. Essentially, the company is looking at where its bread is buttered, and that is clearly in the US market, where there is a vast pool of capital for pharma companies to tap into. It's generally where it does a lot of its business, at least half of its sales, and a good proportion of the drugs that it signs into its pipeline are produced by US biotech companies. So it's an entirely logical move from that point of view, but it is set against this background of squabbles in the UK over drug prices. I think we've spoken about this before, that companies are saying, well, we can't operate here anymore because the environment is not conducive to it. And Astra and others have been pulling various investments from the UK and shifting those to America, although I'm sure the tariff regime has a good portion to do with that.
There was, in fact, a story just in the last hour on Reuters saying that pharmaceutical executives are getting near daily calls from White House staff to cut individual deals of the kind we saw with Pfizer. They specifically say that they are trying, or were trying, to get AstraZeneca to consider a new headquarters in the US. So clearly there's pressure on them to shift their focus, and maybe this listing is a sort of a halfway house or an attempt for them to stem those phone calls by doing some kind of middle ground, albeit, as you said, it is clear, both from the amount of money they're putting in the US and the general comments from management, that they do see the US as a big opportunity as well. Let's talk about GSK. Again, we spoke about them a couple of weeks ago, but on Monday there was the news of the CEO succession plan. Can we say a bit more about that and what that might herald for the company?
Yes, I mean, long-time CEO Dame Emma Walmsley, is stepping down at the end of this year, 1st of January officially. They welcome a new CEO in Luke Meals, who is the current commercial director. It's an inevitable change, I think. Dame Walmsley's been there for a good period, and she was brought in to overhaul the company, to spin off the underperforming consumer healthcare bit, and she has achieved all those things. So, it's a kind of inevitable handover, really. But it was a necessary appointment for her, really, in a sense that GSK was a vastly underperforming company in comparison to AstraZeneca at the time she was appointed in 2017, and the overhaul that she has initiated and overseen will probably stand in good stead as as it develops its pipeline and essentially remodels itself into a proper biopharmaceutical company and not one that used to sell Lucozade as well as complex antiviral drugs. It's a very it's an inevitable turnover. I mean, I think the fact that it seems to be going quite smoothly speaks positively of her record. She probably the problem that she has is, in terms of if you look back over how the share price has performed, it's very difficult to compare apples with apples because the company now is very different to the one that she took over. But the share price in relative terms hasn't really gone anywhere. But that is probably not her fault. And it's up to now to Luke Meals to prove that his experience in getting products off the ground, filling the pipeline, which he's done, at quite a few places, Sanofi, Roche, even AstraZeneca, that he can take it through the next stage of its kind of development and transformation. So he kind of starts with a blank, he starts with a stable company and a blank slate. So I think that's the ideal handover situation, really.
In some ways, you could say the jury is still out on her tenure, couldn't you? If GSK does now develop and progress from here, it might be a situation where people will look back and say, well, she did lay that foundation and that's clearly what the company will be hoping. If not, then yeah, she may be one part of a wider malaise. I mean, that said, I suppose you think of Rolls-Royce as a company where Warren East, the former chief exec, potentially put in place some of the nuts and bolts of its subsequent massive share price rally, but he's not really mentioned in that context anymore. So it could go either way, I suppose. Let's finish by just looking at the valuations of the two companies. Again, we've talked about this in recent weeks, but is it fair to say at the moment GSK for income, AstraZeneca for growth? There's still potential for GSK to grow too, clearly, but that's the situation as it stands. What's your view?
Yeah, I mean, that's essentially sums it up quite well. GSK, you're getting over 5% at the moment, and Astra is a premium to everybody else in the European market in terms of its PE valuations, well over 15. Whereas that you can pick it up for 14 or so, and if you buy a normal pharma company in a European context. So it's yes, that those are the two twins we have in the UK market at the moment. Astra just has to keep going as it is. Its problems will come later down the line, maybe when Pascal Soriot steps down and they have to find another CEO. And GSK will now have to think about its own listing prospects, whether it wants to stay the way it is here in London, or it does go for this kind of dual listing model that Astra is going through. So, yeah, it has spoken about betting big on the US. So that might be the task for the next chief executive to look at how it follows through with a US strategy. That might be the next thing that investors can look at with some interest.
Well, there will undoubtedly be certain pressures on them to do that too.